Good evening. I'm Trish Hall. I'm the Medical Center Director at the Truman VA Hospital. Welcome to our Facebook Live Veteran Town Hall. I'm joined today by Dr. Zare and a host of other subject matter experts here at our facility. There's a couple things that I'd like to bring forward to you and discuss with you, and then later we'll open it up to some questions. But first and foremost on my mind is veteran safety. And although we'd really like to do this in person with all of you, it really is best that we use other mechanisms to have discussions like this, because it's really important that we observe social distancing. Stay at home unless we absolutely have to go out for something, and if we do, stay 6 feet apart from any other person. Also, if you do come to our facility, you'll see some other things that we're doing to keep our veterans and our staff safe, such as screening protocols. If you come to visit us, you'll actually drive up to a screener that'll ask you some questions about how you're feeling today before you park your car. And then when you come in, they're also going to ask you some more questions and take your temperature, just to make sure that you're feeling okay and we're not spreading any germs around our facility. But I want to let you know that even though we are doing some things virtually, we are here for you. We have not shut down, and we are still taking care of you. Some of your routine visits will have been done by phone or by video or even delayed a little bit. But for things that you need or health care that you need, we are here and we are open. If you need to be seen, please don't hesitate to call us at 573-814-6000. We are still here for you. And with all of these changes, these disruptions in our lives can really lead to added stress. We have to be really mindful of that. If you need any care related to stress, please call us. Again, 573-814-6000. Or if you have a mental health provider, give them a call. Or if you really need emergency mental health care right away, please call 1-800-273-8255 and press 1. That is the mental health crisis line. Besides stress, this also may be adding to some financial hardships for some of our veterans. And we're very aware of that. If you have been experiencing some financial hardships, and perhaps in the past you've enrolled but have been told that you make too much money to be seen here, please give us a call. We'd like to talk to you again and enroll you under a hardship circumstance. That number is 573-814-6535. That's our enrollment department, and they'll walk with you through some of those steps. And the last thing I'd like to talk about is our great staff. I can't say enough thank yous to our staff for all that they're doing for preparation to take care of our veterans and our communities in this time of national emergency. We are constantly looking for ways to keep them healthy and safe as well. So they too go through some different screening protocols. Some of them are teleworking. But it's really important that we work really hard to keep our staff safe and healthy, because they can't take care of our veterans when our veterans need them if they're not here because they're not well. So those are the messages I have. Do you have anything that you'd like to add to that, or would you like to open it up to questions?
Any questions yet, Heather?
No questions yet.
Well, what I will say then is something that we've been telling our staff as well as our patients is please try to avoid getting sick. And to avoid getting sick out in the community, that means that you stay home as much as possible, like Dr. Hall said. And when you do have to go out, try to go when things are not as busy. And I know that a lot of the grocery stores have early shopping hours for older people. Please take advantage of that and try to stay away from people as much as possible when you're out. Wash your hands. Hand hygiene is super important. And don't touch your face when you're out. So when I get home from work, or when I get home from a necessary run to the grocery store, the first thing I do is wash my hands. I also clean high-touch surfaces frequently, like my phone and like the doorknobs in the home, the mailbox, things that other people touch, your steering wheel, latch to get into your car. Clean all of those things frequently. That's how colds and viruses transmit for the most part, is by touching surfaces and then touching your face and getting those viruses into your eyes or into your nose. Those are tips that we're giving to our staff and to our patients.
Absolutely. You know, our community's really been very good to us here at the facility and to our veterans as well. And I would be remiss not to thank all of our community partners that have stepped up and helped with little things for specific veteran needs, as well as helping us to do things like cater some meals to our staff that are working extra. Our small business communities have really stepped up and helped us with those types of things as well.
Our staff's also stepping up, and we have sent some supplies to New Orleans VA, and we're sending some staff there as well to help them because they're really experiencing a surge in infections. And hopefully that won't happen here, that we have such an overwhelming number of people ill with COVID-19. But if we do, I think we can bet on receiving help from other VAs as well.
So we do have one question. Has the community care program been canceled?
It has not been canceled. We still have our community care program. What we're doing right now, though, is along with all of our community partners, we are postponing or suspending routine care. So if you have something that is necessary, you have an urgent issue, you will be taken care of. But if it's something that's routine that needs to wait, then we're asking you to wait. And that's true for people out in the community as well. So most of our community partners are not scheduling appointments for routine issues currently.
You know, I don't know if all of our viewers know, but we have a nursing home here in our facility, and we're taking extra precautions. As you've heard in the news, nursing homes are an incredibly highly susceptible area for the spread of COVID, and it's really dangerous for those patients. And so I'm joined here today with Jill, and perhaps you'd like to come and talk to us just a little bit about what we're doing in our nursing home area to keep our veterans there extra safe.
Sure, thank you. There we go. So in our community living center, we have shut our doors because they're usually open. And then we're also doing an extra screening for every employee that comes into the community living center. We have stopped the traffic of, like, we're meeting the dining service people at the door to bring in our food. Our housekeepers, there's certain ones that are specified just for that area, along with the staff. One thing that we are implementing as of today was we're going to be asking all of our staff members to make sure that they take their shoes off and leave them here, and so they don't go out into the community. We're asking them to make sure that if they do wear extra, like, jackets, to make sure they leave them here, and if they do take them home, to make sure they wash them every time before they come in. We have done special things to have visits with their loved ones, and we have our social worker has an iPad along with our recreational therapy, and so they do visits with them over the phone or iPads. We've done everything we could think possible, and everybody's we're looking at resources from the community to see what they're doing with the other nursing homes, and we just want to keep them safe, and we're doing extra activities. We have a wonderful patio, and we've been utilizing that, and they absolutely love that. So those are some things.
Thank you. Yes, it's really important that we keep those staff away from potentially infected areas of our facility, so we don't have those staff working in multiple areas. Those staff are dedicated there, and then we want to dedicate, like you said, their overcoats or their shoes to that space, because it is our extra clean space, not because you're going to be bringing germs out, but because we don't want to inadvertently bring a germ in from a grocery store or anywhere that they've been before they came to work. So thank you very much. Do we have any more questions?
We do. Will the VA see any non-veterans at this time?
Well, I'm not sure if our viewers know, but one of our missions in the VA is emergency preparedness and emergency response for the nation. So that is a potential. We have not been asked to do that yet. The New York VA in the Bronx has been asked to do that, and they do have civilians in their facility right now. So we are preparing for that should we be asked to do that in our community.
There is a question on what can we do to help our veterans at this time?
That's a great question. And I've had other veterans ask me that as well. I think being a good neighbor is the best way to help veterans in your community. You may have veterans in your neighborhoods and in your cities and towns that are elderly and can't get out. And it would be really great if you could run errands for them, go grocery shopping for them so that they can stay in their homes. I know a lot of people are doing that. We've had some people give us their names here and say, hey, I'm willing to help veterans in my area if you find someone that needs help. And we've been sharing that information. Some veterans may not have good access to food. There are a lot of food pantries in each county generally has some type of a food pantry, but maybe they can't get there to pick up the food. So if you could help in that way, that would be really great for those veterans in your area.
Absolutely. And then just social isolation is hard. So just reaching out and giving a phone call and saying, hi, hey, how you doing? If you know that a veteran that you usually see at some social event or the church, and we're not doing those things now, give them a call, reach out to them, just to make sure they're doing okay.
And we're doing that for all of our veterans currently. We're calling every single veteran that we take care of and asking them those specific questions. Do you have access to food? Do you have enough food? Do you have any concerns with your housing? And talking about social isolation. What we're finding is that most people are doing okay right now, but when we do find that a veteran has issues, we're linking them up with resources to be able to help.
And then lastly, we have a very robust voluntary services here at our facility that right now our volunteers are really not coming into the facility because they need to stay at home and observe those orders. But our voluntary services is still open, and they're still accepting donations for things that veterans may need, such as different food, socks, toiletries, all of those things.
There's no more questions.
Well, we don't have any more questions. I'd like to ask my assistant director, Paul, if you have any other words that you'd like to say before we close, maybe about how you're preparing the facility.
Good evening, Paul Hopkins, the Assistant Director here at Truman VA. How we prepare the facility and making sure that our veterans are taken care of. We're making sure that we have extended our hours as a leadership team. We actually have our Associate Director, Rob Ritter, who comes in at 5 o'clock. They go through and they round throughout the hospital with staff. And then we have another group that comes in from noon and works through 9 o'clock, sometimes 11, and we round with staff, we answer questions, we make sure that they have enough supplies and that they're taken care of. We truly believe here at Truman VA that our happy staff will take care of our veterans, and if they have any questions or solutions or even problems that we can help with, we want to be readily available to help with those. That's all I have.
Questions, can Cookie pop this information in about the debt relief program for repayments?
I don't have my phone.
Okay, no, that's okay. So can you just give the number of 573-814-6445 if they need to do repayments? It's like repayment plan.
So there is a comment that came up on Facebook about repayment plans, and there is a phone number to call. So again, sometimes some people may be feeling some financial hardship from this unique circumstance we're in. So there is a phone number you can call for that. That is
573
573
814
814
6445.
6445 for debt repayment.
And we did have another question come in. Can you please explain testing protocols? I'm guessing that's for COVID-19.
Oh, absolutely.
Well, the testing has been changing. It's been evolving rapidly. Currently, we're testing anyone that may have symptoms that could be consistent with COVID-19. We're testing employees who may have been exposed or employees who may have symptoms consistent with it as well. And if you call your PAC team, if you're worried that you may have COVID, you can give them a call. They can talk to you over the phone and see what they think about your symptoms. And then we have a testing protocol here at the facility. We're currently not testing at our C box, but we are testing here in Columbia. There are some places out around our catchment area, like Lake Regional Hospital, that are also doing testing. And some of those places are doing testing for free, but I would check with them before you go. But for sure, here, for veterans, the testing is free.
Well, we seem to not have any more questions, but we're still always here for you. So if you think of something in the future, please don't hesitate to call us so that we can get you to the right people to answer your questions about your healthcare needs or any other needs you may be experiencing during this unique time. So thank you very much, Dr. Zare and Paul and Jill, for all of your help here, and thank you for watching us. We really appreciate it. Bye-bye.